Hello and welcome to Bits and Atoms, the Grisham Robotics Founder Series. I'm your host, Elias Can, and today I've got Anna Aydinc, co-founder and COO of WellQ, joining me. To get started, Anna, would you mind sharing a quick intro about you and WellQ?
Sure, Elias. Lovely to be and to meet here and to be here with you. My background is I'm a clinical founder, so is my co-founder. We have been working in healthcare for the last 15 years. And out of necessity, we have built WellQ. WellQ is continuous monitoring within musculoskeletal care that is working towards MSK prevention, preventative health.
Amazing. And we'll definitely get more into the product side and scope and what you're working on there. Maybe just to take a step back and look at you personally first, what kind of originally motivated or inspired you to make the leap to become a founder?
I think it's probably the same thing that motivated me to become a clinician in the first place as well. So as you can pick up from my accent, I'm originally not from the UK, I'm German, and actually my co-founder is from Australia. We both came here around 20 years ago. And for me, one of the key things that I love is I love to achieve. I've always loved to achieve. And for my patients, I love to achieve their best, their most meaningful outcomes. But throughout my career, I have had a variety of different roles. So when I look at the founder journey or when I look at the entrepreneurial journey, I think entrepreneurship starts very early on. So my first ever job was age 16, working on a fruit and vegetable stall, then moving into hospitality, traveling the world quite extensively in my early 20s, during which time I picked up my husband. Then we settled here in the UK, coming here with literally 250 pounds and straight away moving into sales and essentially making it. So I like the idea of creating something from almost nothing, always pivoting around different ideas. And I also am a great believer that we all have potentials that we need to fulfill. So for me, it was never a question of, am I going to build something? It was more around the timing of when will I build something? So obviously we have a family. So one of the aspects was waiting for the kids to be of the right age, which it couldn't be more perfect at this point in time. And also in terms of the product that we would build, when will be the right time for the product and how will I find my co-founder? And I met my co-founder in clinic. So Simon Gilchrist, he's an Australian sports physio. Like I mentioned, he had come here to the UK and he's built and scaled Mayfair Health to millions here. Within clinical practice, we pretty quickly understood that we have the same mindset, and we decided to build our technology out of that mindset of wanting to optimize people. And that creates some really interesting challenges and new adventures and new learnings along the way.
Absolutely. And love to hear a good serendipitous founder connection story. That's always good to find someone you vibe with and can see yourself working with as well. It's co-founder dating and finding folks today can always be challenging. And so it's great that you both are on the same page and able to make the leap together.
Absolutely. And we did a really interesting co-founder compatibility testing before we started building. So where I love to achieve, Simon loves to win, which is like a great combo when you stick those two together for any startup. And yes, I mean, being clinical founders, particularly sort of like the journey that we took, we understand the product from a clinical perspective. Which I think is a huge advantage to, let's say, technical builders that love the technology but might not understand that technical pathways, but the clinical pathways. But that was also quite a learning curve for us, because where we might criticize technical founders that the product might not clinically be sound, our expectations of how easy it is to build technology might have potentially cost our dev team 1 or 2 ulcers along the way.
Yeah. Yeah, it's kind of like you said, like folks that are either tend to be more domain experts on the space or maybe tech experts in the fact that they think they can build for anything quickly and amazingly. I mean, healthcare is definitely one of the places, broadly speaking, where it is usually much tougher to build quickly and break things or have things go wrong because there's sensitive patient data and outcomes that you could be affecting by doing it. It's not like it's like, you know, a mobile game where if you do the payment rails wrong, like who cares? That ultimately it's obviously a bit more sensitive if it's anything associated around health.
Yes, absolutely. And it's, I mean, healthcare and health tech is very much built around trust. Unlike other startups where, yeah, you can build something, break something. If you break clinical trust, your product dies and the credibility dies. So having something that is relatively sound from the beginning for the clinical adoptions so that other clinicians will want to buy into that is actually really important.
Yeah, absolutely. Yeah. And having that background on the clinical side as well definitely helps on the trust piece. For you, was MSK kind of like your focus area on the clinical side?
Absolutely. I mean, this is our bread and butter. Like I said, Simon is a sports physio by background. I am an osteopath by training. I've also trained in lifestyle medicine. And this is what we see on a day-to-day basis. And WellQ was born out of necessity. So there are a couple of issues that we face within MSK care, particularly within private care. And that sits around patient engagement. I mean, patient engagement is an issue across all of healthcare. We know about issues with medication adherence, following lifestyle advice, whatever it might be, and MSK care is not immune from that. So if we give patients rehabilitation programs for them to do at home, the dropout rate out of those sits at 65%. And for private MSK clinics, that kind of dropout rate eats directly into the revenue, but actually in a bigger picture, it leads to chronicity of the patient if they don't actually follow through with their rehabilitation. So one of the key issues that we face is that as a system, MSK care is completely reactive. And this is one of the elements that we want to change. You only tend to come to us once your body starts to break, right? But what if I would have all the data that I could predict when you will most likely start to develop pain and whether that pain will become chronic and whether you will require surgery for that. And that is what we are evolving towards. So we are building a piece that sits around continuous monitoring that will drive engagement for the patients. But from that continuous monitoring, we are building the data that will help us to predict and prevent in the long term.
Very cool. And yeah, it feels like healthcare a lot of the time, generally speaking, is reactive and prescriptive. I mean, especially in the U.S. healthcare system, things go wrong. They give you some kind of pill or suggest some kind of surgery, but there's probably a whole host of things folks could have done upfront to have never been in that situation, or at least try and catch or detect it earlier. Certainly is a big challenge, and definitely, if you can get that piece earlier. I know value-based care is something that floats around a lot in the industry. Especially for the U.S. side, I know I'm obviously a little less familiar with the U.K. system, but I know in the U.S., like a movement towards some kind of value-based care would be great, and more predictive technology is it.
The financial impact is huge. MSK conditions are the leading cause of disability globally. And despite it being such a huge problem, and we would all think that the problem is moving towards being solved, it's actually only getting worse. So according to the World Health Organization, the estimation is that low back pain alone will increase by 36% by 2050. And we're not even talking about shoulder, knee, and any foot pain, any other kind of conditions that we might have. The overall combined cost for MSK care is sitting estimated around in excess of $2 trillion annually.
Mhm.
That was a figure that was published in the International Journal of Surgery. So these are all estimations. It's a massive, massive problem.
Yeah. That's enormous.
Yeah.
And what tools do clinicians use today? Because you mentioned kind of that continuous monitoring care piece that you're working on, and I want to hear more about that. But maybe what's kind of like the standard that clinicians will use today, and how do patients interact with that?
Mm-hmm. So maybe it's worth to kind of understand what the patient journey is at this point in time. So
Yeah,
it
that'd be
much
great.
depends on the vertical that you are in. So here in the UK, we have public health, which is predominantly the NHS. We have private health, and then we also have elite sports. Within all of those areas, rehabilitation tends to happen. So as a patient, you're in pain, you will go, you will see your doctor, you will be triaged, you will be sent to a physio. A physio will most likely put together a plan, give you a sheet of paper with your exercises, off you go, hope for the best that you will do it, and you will have maybe around 5 sessions. In private MSK care, we tend to have more time with our patients, 30 to 60 minutes per patient, and we might potentially have more sessions in a week with them as well. The other thing that we tend to have the freedom of in private care is multidisciplinary care. So we tend to look at what are all of the factors that this particular patient needs to optimize their rehabilitation. So whether that be nutrition input, sleep psychiatry, sports psychiatry, personal training, anything to help this patient on their rehab journey. But both of those still have a key gap within that system, and that is that I only see a patient for 30 or 60 minutes. And then the rest of the time, I have no idea what they're doing. I don't know if they're doing the exercises, if they're doing them correctly. What are all of the factors that are impacting their ability to recover? And essentially, that is the gap that WellQ is filling by continuously monitoring and then acting on it, informing me, the clinician, but also informing the patient in real time. So in terms of the tools, like I said, in public health, you would get an exercise sheet. In private health, there are 2 options. One are MSK engagement tools that upload exercise programs. So either clinician can put together a rehab program, which will then be emailed to a patient. That might be a video with some explanation, explaining how many reps, how many sets. Then the next level up from that is a new technology that is gaining in popularity, which is computer vision. I don't know if you've come across that. Essentially, I open my phone or I open the laptop, I will see myself, and I will be guided in real time through my exercise program. But all of those solutions very much focus on episodic care. And what we are doing differently, we're capturing truly longitudinal data, optimizing beyond the rehabilitation and trying to look at optimizing MSK health towards that prevention piece as well.
Yeah, interesting. And I'm familiar with Sword Health, I think, does the last piece that you mentioned around CV for seeing people actually doing the rehab work. I know they usually have folks use a phone or a tablet or something like that to record. That's the one that I'm probably the most familiar with.
Yeah. That is one of the players in the market. There are a variety of others, but again, it focuses on episodic care, and it focuses more on predictive models, on exclusive surgery risks, but they don't have truly longitudinal models to model really effectively in this hyper-personalized way. So I think the future of health, the future of medicine really sits around hyper-personalization. I mean, it's one of the reasons why so many of us use wearables now, right? I use a Whoop, the Oura Ring, whatever it might be. And most physicians have no idea what to do with that data. The wearables themselves go through fights with the FDA about whether they are medical devices or not. And someone needs to connect all of those dots, and that's what we're doing.
Yeah. I mean, I sometimes don't even know what to do with all the health information I get from my wearables. It's optimizing is good, but I think like it's also hard to optimize for everything. And so, yeah, maybe I can only imagine to abstract it away on the clinician level where you're looking at hundreds of patients. Like it's not like they're narrowly just like focused on me and what they can do. It, like you said, they need to see a lot of people. You spend a little bit of time, you need more of that, probably technical and maybe some kind of AI component as well to be able to sift through a lot of this information that is coming in and they just don't know how to use it right now.
Yeah, exactly.
Yeah.
That is what we're doing.
And maybe one last question here, and switching gears a little bit, because I'm always curious to get the founder perspective on this, you know, in terms of kind of fundraising or pitching and meeting with investors. You know, what have you kind of found to be best strategies or hacks on that side? Or if there's things that you would tell a first-time founder to totally avoid, you know, curious on your thoughts on that.
Sure. I mean, we've obviously just completed the Grisham Robotics VC Accelerator, and I think for any founder that is thinking about completing it, I would highly, highly recommend it. Genuinely, I think it was amazing value. I think as a first-time founder, even thinking back to myself specifically, coming from a clinical background and learning along the way, you have to understand that this is a full-time job. And even when it was told to us, we didn't quite grasp how full-time of a job this was. So we completed an incubator last year, and on the back of that, we raised a small friend and family round that allowed us to build the product, which is now onboarded. But in order to raise your actual pre-seed round, that is very time-consuming. You have to love data, you have to love, and you have to be able to just log in and run through thousands of investors. Whether those are VCs, family offices, angels, you need to analyze across their investment theses, across their portfolios. There's a lot of work that needs to be done. You can use AI tools to help you. That is one of the advantages, to slow down some of the time. Claude can help you build certain technologies, which historically you would have had to pay for. But just get ready for, you need to really double down on that and be committed to it.
Yeah. I mean, I think fundraising is like another full-time, long time-consuming process on top of like running your startup as well. I always want and empathize with founders because I think the fundraising is kind of like a necessary evil in some way, and they'd really like to get back to building and working on the business as opposed to doing a lot of the fundraising work.
Absolutely, but there's also an element that it's exciting, right? It feeds into, if you have a background in sales and if you love sales, an element of fundraising is understanding sales. You have to become very, very comfortable with a no over and over and over and over, and you just have to keep going regardless. So yeah, that is, we will be opening our round pretty soon. So watch this space.
Amazing. And we'll definitely blast it out as well once things are kicked off and going. That would be great. And we can include some contact info here as well for prospective investors who are watching here to get in touch with you to kind of grease the wheels on that.
Awesome. We'd love that.
Of course. And we're at time. So I want to thank you, Anna, for joining me today on Bits and Atoms. It was great to have you. Really appreciate the conversation. I'll let you get back to building. And thanks again.
Thank you, Elias. All the best.